Now, what is the structure of this unit? That will analyze first. Introduction is given as usual. Objectives are also written as usual. The main point is definition and purpose of clinical assessment. Now you have to compare the definition and purpose of counseling assessment. So this part is very easy for you. You have already learned about counseling assessment. Here you have to learn about clinical assessment. In counseling, we do counseling of 80% of the population, particularly students and career. That is the main focus of counseling. Whereas in clinical, we handle disorder. Now, the another important head is types of psychological assessment. Now here, types of psychological assessment, here it is given from the point of view of clinical psychology, means from the point of view of assessment of disorder. So these are the distinct one than the test we have studied in counseling psychology. So psychological assessment is common in counseling and clinical, but the tools are different. We have used different tools in counseling and we are using different tool in clinical assessment. Then the referral. It is about the person who accompanied the client, what he says or what she says. An assessment in clinical psychology, that is about this assessment in clinical psychology. This title is more or less inaccurate. Here the title should be diagnosis and treatment in clinical psychology, because here we are going to decide the therapy, we are making a plan for therapy, and we are going to conduct the therapy, and then finally we will evaluate the therapy. So this word assessment should not be required here. The word should be diagnosis and treatment in clinical psychology. Now I am giving you one sequence. Keep that sequence in mind, so your understanding will be better. What happens first? The client comes to you. That is called as client's visit. Then what you do? You have a interview with the client. What you have? You have an interview with the client. Now interview can be structured interview, unstructured interview. If it is a structured interview, you will have a ready questionnaire, and if it is an unstructured interview, then you will ask questions on your own from any part of the life of the client. At the same time, you have a choice of using a test, or at the same time you have a choice of using DSM-4 or DSM-5 screening test. So immediately after rapport building, you take interview and you go for testing. So testing, either you will use DSM-4, DSM-5 screening test, or you will use exhaustive, a detailed test. So as the test is over, testing is over, you are going to draw meaning of the score obtained on test or screening test. You combine your observation interview observation of interview with the test result. Now, after combine observation of interview and the test result, the process of assessment is over. Then we evaluate. Then the psychologist is evaluating the client. What kind of disease he has, what can be possible treatment. So as the evaluation process begins, we are going towards making treatment. We are shifting towards making treatment. That process is called as diagnosis and treatment, or it can be called as evaluation and treatment. Evaluation and treatment is more appropriate word in counseling psychology. Diagnosis and treatment is more appropriate word in clinical psychology. Yeah, again, diagnosis and treatment is more preferred statement in clinical, and evaluation and guidance, or evaluation and counseling, is the right word in counseling psychology. The process is almost same. The words are changing. So ये जो difference of the word है, इसको अगर आपने समझ लिया तो फिर बहुत आसान हो जाता है. अब हम लेते हैं definition and purpose of clinical assessment. What is given here? Definition of psychological assessment. Psychological assessment itself. Psychologist as a detective. Comprehensive assessment. Psychological assessment as important tool. Reliability and validity. Now, we'll understand this first part from my knowledge point of view. Then we'll go into detail. Definition of psychological assessment. How psychological assessment can be defined? Just try to understand how it can be defined. It can be defined as the process. So psychological assessment is the process of diagnosing or finding out the root cause of the problem of the client. Diagnosing the root causes of the problem of the client. That is the way simple definition has to be kept in mind. We'll see later on what is given in the book. What is psychological assessment? It is the assessment of a psychological factors. Now, what are the psychological factors? There are some personality factors. There are some cognitive factors. There are some social factors. There are some emotional factors. So psychological assessment means assessment of emotions, thought, behavior, and abnormal part of the behavior of the person. That is the way we can say psychological assessment. Then psychologist as a detective. In a counseling, you need not to be a detective. You have to just do the inquiry. Similar to the inquiry which is done in family. कहाँ गए थे, क्या कर रहे थे, क्या क्या हुआ, कैसे हुआ, तुमने ध्यान क्यों नहीं दिया? That is family inquiry. Now, in clinical, you have to do police inquiry. Police inquiry. You have to be careful and always have a doubt in your mind about the answer given by the client, whether it is right or wrong. But you can't say, आपको बताना नहीं है answer is right or wrong. But you should have a doubt and you re-investigate. You try to reconfirm your doubt. That is called as detective. means you collect the proof of the doubt. Then you have a proof. So what are your proof? Psychological test results are your proof. Recording of clients discussion is your proof. So you as a psychologist becomes the detective for detecting the abnormal behavior of your client. And you detect the entire behavior with proof. हमेशा याद में रखिएगा, you should have a proof of a abnormal behavior, because client कभी भी बदल सकता है, और client के surrounding में जो लोग हैं, parents और any other people who is accompanied can anytime claim, यार your psychotherapy is not working properly, और you हमने आपने हमारी केस बिगाड़ दी, ऐसा क्लेम आ सकता है. तो पर्टिकुलरली इन क्लिनिकल असेसमेंट यू शुड हैव अ प्रूफ. फुल प्रूफ काम करना है आपने क्लिनिकल असेसमेंट. दैट्स व्हाई इट इज कॉल्ड एज साइकोलॉजिस्ट एज अ डिटेक्टिव. कॉम्प्रिहेंसिव असेसमेंट, it is detail assessment. Comprehensive means detail assessment. So what is a detail assessment? A person of 40 years is sitting in front of you. So in a detail assessment, you will investigate about what has happened just before 1 week, before 1 month, before 1 year, before 5 years, before 10 years, and before 20 years. So you have investigated the adulthood part. Then from adulthood, you will shift to adolescence age. What has happened between the age of 12 to 20 years? And from adolescence age, you are going to shift to a childhood. What has happened with you from 3 years to 10 years? And later on, you can shift to infancy. So nobody remembers about the infancy. So you have to investigate it from the parent about the infancy. And prenatal, when the person is in the womb of the mother, that can also be investigated from the parent. Now, some pseudo psychologists also go beyond that. They do regression, hypnotherapy, and they try to find out what has happened in the previous life. No, that is not the job of clinical psychologist. Going to previous life is not the job of clinical psychologist. That can be the job of regression expert. That can be the job of hypnotherapist. But for clinical psychologists, the investigations stop till prenatal period. You can go in the history of ancestors. दादा कैसे थे, दादी कैसी थी, नाना कैसे थे, नानी कैसे थी. You can have an investigation of their client's parents and client's grandparents, even their parents also. But you cannot go to the previous life of your client. मैंने कई हिप्नोथेरेपिस्ट से और कई रिग्रेशन एक्सपर्ट से कहते हुए सुना, प्रीवियस लाइफ में ये बिल्ली थी, प्रीवियस लाइफ में इसका एक्सीडेंट हो गया था और बहुत कम एज में इनका डेथ हो गया था, इसलिए इन्होंने नया जन्म लिया, वगैरह वगैरह. दैट इज नॉट द पार्ट ऑफ क्लिनिकल साइकोलॉजिस्ट. So that way it is called as comprehensive assessment. Now, psychological assessment as important tool. Yes, it is fact. Psychological assessment is an important tool. And previous session I told you, in some cases, psychological assessment, particularly tests like MMPI, CAQ, EPQ, are equivalent to physical instrument of medicine. As good as, they are better. Means दोनों से भी निकाला हुआ रिजल्ट एक जैसा ही आता है. Then reliability and validity of clinical assessment. It is already told to you. Now, but here you have to be cautious. Some instruments are not very much real. Some instruments are not very much valid. Some instruments are valid in United States, but the same instrument may not be valid in India because of the diversity of religion, language, and locations. And reliability, a test is having reliability more than 0.80 or more than 0.90 is considered as most reliable. The test having reliability score of below 0.8 or 0.85, do not assume that the test results are very good. You have to investigate the problem from the other perspective, from the other angle. That is the meaning of reliability and validity. Validity means the test which is used is really useful to measure the same thing for which you are using it. Means if it is a test of intelligence, so whether it is really measuring the intelligence or not, that way no test is 100% valid. SPM, standard progressive matrices, the validity is expected up to 0.92. CAQ, clinical analysis questionnaire, MMPI, the validity is almost above 9.9. Now, technically, what is reliability and validity? You have understood in statistics. So I will not give much more emphasis here. यहाँ तक क्लियर है ये टाइटल?
Yes, sir.
I just want to have a discussion with you. Yeah, okay, I will take a discussion later on. Types of psychological assessment. Here, addiction assessment, description of FAMHA. It is a short form of some long test name. MISU is also a short form. SUMI is also a short form. MCSU is also a short form. Development of the scale, again the validity and reliability of psychological assessment from the point of view of these tests. Here the validity and reliability is discussed from the reliability and validity of this test, MISU, SUMI, MCSU, etc. Then referral. Referral, particularly the reference taken from other by the clinician, maybe parent, maybe friends, maybe boss, maybe colleagues, maybe peers. And then last part is assessment in clinical psychology. Evaluation is over. Your assessment is over. Your evaluation is over. ये word assessment काट के यहाँ पर है ना treatment लिख देना अपने बुक में, नहीं तो confusion होता है. Treatment in clinical psychology. So to do the treatment, you have to first decide the therapy, which therapy you will use. You will use client-centered therapy, CBT, CEBT, suggestion therapy. There are n number of therapies. I came across with 100 number of therapies, but some therapies are common. Most important approach nowadays is client-centered therapy or humanistic therapy. You have to view your client from the humanity point of view. So that way you have to decide the therapy. Then planning the therapy. Now here planning the therapy means actually you have to tell the time period to the client. You have to tell the possible result which can come. You have to tell the cost of the therapy. You have to also tell expected result of the therapy. And you have to also tell whether your therapy will be successful or not. If succeeded, then what? If failed, then what? So that is called as planning the therapy. Then conducting the therapy. So actually execution. Conducting the therapy means actually you are executing the therapy. Say for example, you are executing the hypnotherapy. So you have given a time to a client and you have given a suggestion, come by eating some food, or if he is not eating some food, so offer some kela vagare at your office, and then ask him to sleep on the chair or the bed or whichever the arrangement is there, and then you start hypnotherapy. You start giving the suggestion so that the person can go to sleep, but it is not actual sleep. It is a semi-sleep condition. That is called as, Marathi mein it is called as gungichi avastha. In psychology, the word is trance. Trance. In psychology, we called it as, the state of mind is called as trance. Trance is not sleep. The state of mind is a stage between sleep and awakening. दोनों के बीच का स्टेज, उसको बोलते हैं अल्फा बीटा गैमा. अल्फा इज अवेकनिंग, बीटा स्टेट ऑफ माइंड, उसका एक नाम भी है बीटा स्टेट ऑफ माइंड. देन इवैल्यूएशन ऑफ अ थेरेपी इज डन, मनी इज टेकन. सो वेदर द client has received something out of your therapy. Psychologist has already received the money. So client has to evaluate whatever the money paid is appropriate as per the relief or not. And the clinician has to evaluate whatever the therapy is given, the client is improving or not. यहाँ आपका यूनिट 3 टेक्निकली समाप्त होता है. आपको ज्यादा मेरे को एक्सप्लेनेशन करना है FA, MHA, MISU, सुमी, ये जो टेस्ट के नाम है, अब ये टेस्ट सब अमेरिकन टेस्ट है. मे बी आई एम नॉट मच एक्वेंटेड विद दिस टेस्ट, बट आई हैव ऑलरेडी रेड सम कंटेंट. सो I will proceed rapidly in this part, and then I will go in this part in little detail. But by that time, we'll have a discussion. अभी आप लोग सेकेंड ईयर में गए ना, तो you have to learn to discuss also. जैसे जैसे you will start discussing with me, probably the ideas will be very clear. So I want to just have a discussion on this structure. How much you understood. That's why I'm keeping this structure open for you. And by that time, tea is received. So I will take a tea. And you prepare to ask a question on this structure.